Hi everyone. In this clip, I will talk a little bit about breast cancer. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So, breast cancer has many types, and not all of them are the same. The treatment plans very much depend on the type, of course. They will have something called a pathology report, which is made by the pathologists who test samples of the breast cancer cells in lab, which contains all this info about what type and what they see. So pathologists look at the kind of cells that make up the breast cancer, which include ductal cells. So ductal breast cancer, also called ductal carcinoma, is the most common type of breast cancer. This type of cancer starts in the cells in the lining of the milk duct within the breast, and the ducts are what carries milk to the nipple. Then there is lobular cells. Lobular breast cancer is also called lobular carcinoma, and it starts in the lobules of the breast. The lobules can make breast milk, and the lobules are connected to the ducts, which can carry breast milk to the nipple. Then there is connective tissue cells, and this is a very rare kind of breast cancer. In this case, cancer is made up of the connective tissue cells, and connective tissue cells include muscles, fat, and blood cells. And cancer that begins in the connective tissue is called soft tissue sarcoma. So lymphatic system cells also is part of that, and lymphoma is a cancer that starts in the cells of the lymphatic system. Very rarely lymphoma can start in lymphatic system cells in the breast. We have two different kinds of lymphoma, of course. We have Hodgkin and non-Hodgkin. Most breast lymphomas are a kind of non-Hodgkin lymphoma. When looking at the breast cancer cells with microscope, the pathologists look for cancer cells with unique appearances, and some subtypes of breast cancer are named for the way they look under the microscope. Subtypes like tubular, mucinous, medullary, and micropapillary. So the subtype gives the healthcare team some clues about the prognosis and how the cells may respond to treatment. How different the cancer cells look from healthy cell is called the cancer's grade. Breast cancer grades go from 1 to 3. A grade 1 breast cancer has cells that look a little different from healthy cells. It generally means the cancer is likely to grow much more slowly. A grade 3 breast cancer has cells that look very different from healthy cells, and it generally means that the cancer is more likely to grow fast. So some breast cancers are sensitive to hormones like estrogen and progesterone. So pathologists look for hormone receptors on the outside of the breast cancer cells. Cancer cells use these receptors to catch hormones that are circulating in the body. The cells use these hormones then for fuel to grow the cancer. If a breast cancer is estrogen receptor positive, which is also called ER positive, it means that it has receptors for the hormone estrogen. Treatment with hormone therapy can block the growth of the cancer cells. Another term for breast cancer hormone therapy is endocrine therapy. So if a breast cancer is progesterone receptive positive, it's called PR positive, which means it has receptors for the hormone progesterone. Treatment with endocrine therapy can block the growth of the cancer cells. Then there's hormone receptor negative, is a breast cancer that doesn't have hormone receptors, and it's called HR negative. Endocrine therapy that blocks hormones in the body doesn't work for this type of breast cancer. Most breast cancers have hormone receptors. So some breast cancer cells make too much of a protein called human epithelial growth factor receptor 2, which for short is called HER2. Healthy breast cells make some HER2, but the cancer cells can make a whole lot more. Tests for HER2 can show whether the breast cancer is HER2 positive, meaning breast cancer cells make a lot of extra HER2 protein. For this, normally they use targeted therapy treatments that hurts the cells making too much HER2 and helps control this kind of breast cancer. Breast cancer that is called, also they will see breast cancer that is called that is called HER2 low if some of the cancer cells show signs of making extra HER2. This result can actually happen if only some of the cells are making extra HER2, not all of them. It also might mean the cells making HER2 are making low levels of the protein. So targeted therapy against HER2 may be a treatment option for HER2 low breast cancers in certain situations. Then we have HER2 negative. If the breast cancer cells don't make HER2, HER2, then the cancer is HER2 negative. Now, targeted therapy against HER2 protein obviously won't work for these breast cancers. About 50% of breast cancers are believed to be HER2 low. So some types of breast cancers include, as I have sort of touched upon it a little while ago, is that there's ductal carcinoma. This is also called DCIS, which is a type of breast cancer that is non-invasive, and it happens when cancer cells from a breast duct get into this. And so the cancer cells stay in the duct and don't spread into the breast tissue. It's sometimes also called non-invasive cancer or stage 0 breast cancer. A HER2 positive breast cancer is any invasive breast cancer that makes a lot of extra HER2 protein. HER2 positive breast cancers tend to grow quickly, so as I mentioned before. So then we have invasive ductal carcinoma, and this is a type of breast cancer that starts in the breast duct, and it's the common type of breast cancer. It's the most common type of breast cancer. Then we have invasive lobular carcinoma, and this is a type of breast cancer that starts in a milk gland in the breast. Then we have triple negative breast cancer, which means the cancer cells don't have receptors for HER2 or for the hormones estrogen and progesterone. So treatments that target HER2 and endocrine therapy to block hormones in the body are not going to work for this type. In my opinion, and this is just my view, in reality, a person very rarely dies of cancer. It's always starvation and toxicity that does the job. As the malignant tumor grows, it gives off waste products, which has to be eliminated through the colon, liver, kidneys, lungs, and skin. The waste products gather and gradually overload the lymphatic system, and in turn, the body gets also overloaded. Most people then die of toxemia. So a person going through the detox have to be prepared to accept that there will be a healing crisis. While you're doing the cleanse, the body will purge and eliminate in any possible way. The release of toxins, of course, will bring up physical and emotional disturbance that will be reflected in certain types of symptoms. Healing crisis can last from a few days to a couple of weeks and produce symptoms like fever, headache, and other aches, fatigue, skin eruptions, emotional irritability, gas, temporary constipation or diarrhea, temporary loss of menstruation, yawning, muscular tension, and overall feeling that one might get when they have a case of a cold or flu or food poisoning, so to speak. So I have a very straight to the point book on cancer in general, explaining the ailment and the various natural healing methods and the do's and don'ts on Amazon, which is called Living Through the C Word, if anyone is interested. And aside from the recommendations that I have made in this book, two extremely important points to always keep in mind when dealing with this ailment and throughout the healing process is stay away from anything that turns into sugar in the body and keep a strict alkaline diet. Alkaline diet includes also your emotions, of course. So on the alternative side, we have high vitamin C IV, we have baking soda, graviola, high subtle energy vibrations, pycnogenol, grapeseed extract, proper sleep and relaxation, all part of the healing process. Just like any other ailment, the emotional roots of breast cancer include things like bitterness, conflict, not forgiving or unforgiveness, feeling of unworthiness, inability to nurture, a deep hurt, long resentment, deep grief, hatred, feeling angry, scared, or sad, feeling lonely or isolated, fear of recurrence. So compared to patients with other disease, patients with breast cancer have greater spiritual needs. So keep in mind that your body is an amazing healing machine, and there is nothing that it cannot heal. You just need to provide it the proper environment, physically, emotionally, and spiritually. Also, once you're healed, continue the path and don't go back on the old habits. Hope this has been helpful. Like and follow for more. Be the light.